Thomas asks, hi, Raf. Mate, in the shoulder you mentioned the rotator cable, which is so cool. Tell me, is that what gives way when you dislocate your shoulder, and is that what they fix in surgery? The rotator cable is super cool, and I'm not going to go through a description now of what the rotator cable is, because that is almost a full 90-minute anatomy lecture. But I will talk about what happens commonly, not universally, but commonly when people dislocate their shoulders. And this is what happened to my wife, Julie. So the shoulder joint consists of the socket, which is part of the scapula. Okay, so this is the scapula, the shoulder blade. This is a side view we're looking at. And this is the socket here. And there is a lip of cartilage. Let's see if we can add a layer here. There's a lip of cartilage that lines the socket. There's some cartilage that lines the socket like that, and where that lip of cartilage protrudes beyond the joint there, that is called the labrum. Just the lip of cartilage that protrudes right at the edge of the shoulder socket. Then, of course, you have the arm bone, which is called the humerus, and that has a ball on the end of it that looks something kind of sort of like that. That is called the humerus. That's the arm bone. And the shoulder joint is held together by a bunch of ligaments and the joint capsule. And the joint capsule is just a ligament, which is to say that it is a sort of a structure that goes like that. And is attached to the head of the humerus and also to the labrum. It's attached to the head of the humerus and the labrum. And so that, and there are some other ligaments involved, but most of them actually are part of the joint capsule. And so the joint capsule at one end is attached to the humeral head and at the other end is attached to the labrum. Now, what can happen when someone dislocates is that the labrum can actually come off the scapula. So let's see if we can move that. So and this is what happened to my wife Julie, that her labrum detached. Kind of like that. And so now you have the labrum detached here. And so the joint capsule is also detached, which means there's nothing holding the humeral head, or very little holding the humeral head in the socket. So what they repaired in my wife was and this is called a Bankart surgery. I think that's how you spell it. It's something pretty similar to that anyway. Where they basically go in and they put a screw in, and they put a bunch of screws in. In my wife, they put 5. They put a screw in, and then they put a little stitch in there, and they pull the stitch tight. And what that stitch does and then they pull it tight, and what that does is it pulls the labrum back into contact with the joint surface, with the bone of the scapula. So it just tightens it back down again. And then sometimes what's also happened is that this ligament, the joint capsule, has stretched. As part of the femur popping out, it has stretched a bit, and so what they can sometimes then do is they fold it over. So basically, if it's a long, structure like that, they get it and they just fold it back on itself, and then they staple through it, okay, and staple it down to make it tighter. So they might, nip and tuck through there and make all of that tighter. So that's what they do commonly, and for shoulder dislocation. And the Bankart surgery is a very successful procedure. There's way more than, it's something like a 97% success rate of preventing any further dislocations. So that's a really good surgery. If the problem that's causing the issue is that the labrum has detached, which I believe it is commonly the case. So hope that answers your question.